Welcome to Through the Trauma podcast. My name is Amber Larkins, published photographer, storytelling expert, visual artist, entrepreneur, speaker, and coach. This podcast was born from one question: how do I get inspiring stories of triumph out to the people who need to hear them the most? Come with me, enter my world, where lives are getting changed, heroes are getting developed, and greatness is being achieved. Welcome to Through the Trauma podcast. I am Amber Larkins, your host, and today I have with me a very special guest, Dr. Henderson. Dr. Henderson got a lot of things on his bio that I cannot pronounce, so I am going to give a quick bio here. He is the president and founder of Neuro-Luminance Inc. He's going to explain to us what that is, but this is bringing revolutionary treatments to brain injury, depression, Alzheimer's disease, post-COVID fatigue syndrome, and many other brain disorders. He holds 3 patents, and he's got 3 patents pending. He's been published numerous times and has over 70 publications in top research journals that has been cited over 900 scientific papers. He also has a book called Brighter Days Ahead. It's featured on Amazon. And he is going to have us rethinking brain disorders like depression and brain injury. Dr. Henderson, I know it's a mouthful. Thank you so much for being here. I'm so happy to have you.
Amber, thank you for having me.
Cannot wait to get into learning some of these things. I know you work with PTSD and you have many clients and lots of experience in this field. So your work is much needed. And I appreciate everything you're doing, and I'm excited to jump into some of this.
Yeah, and I think, the way I wrote Brighter Days Ahead was really to make it the science available, the science easy to understand, and to put it in very human terms. There's lots of vignettes of my patients and their experiences with depression and PTSD. And so I think in that way, it's a very accessible book and kind of a fun read. I have a dry sense of humor, and it pops up every once in a while. And probably the most important thing for your audience is to put PTSD in some perspective today from what's going on in the brain, and also to talk about a different way of treating PTSD that we literally invented here at Neuro-Luminance. And that's what we'll call LUMIT, because it's easy to say. And LUMIT stands for Laser Unattenuated Multi-Watt Infrared Therapy. And what the heck is that?
It's a mouthful right there in and of itself.
It is. That's why we say LUMIT. And what we're actually doing is that infrared light, certain wavelengths of infrared light, turn on the mitochondria. And, this is something that, if we're able to do a figure, put in a picture here, it'll make a lot more sense. But infrared light, if it can get through the scalp and the skull and reach the neurons in the brain and reach the mitochondria, it turns on the mitochondria, it activates them. And the mitochondria then sends signals to the rest of the cell, telling the cell to produce anti-inflammatory proteins, as well as turning on a very important growth factor called brain-derived neurotrophic factor, or BDNF for short. And BDNF drives neuroplasticity within the brain. In other words, it drives brain repair. And why does that matter to someone with PTSD? Isn't PTSD, just all your bad thoughts and how you're thinking about things and woe is me and getting triggered and avoiding triggers, and isn't that's all psychology? Well, no, it's actually not. What's going on in the brain in PTSD is the brain is degenerating. Synapses are breaking down, circuits are breaking down. Dendrites, the little branchy things on neurons, are shrinking back and going from looking like a big oak tree to a rose bush in the winter. And so that degenerative change leads to the frontal cortex getting thinner and the hippocampus, the part of our brain involved in learning and memory, getting smaller. And fortunately, that's reversible. And so with treatment, whether the treatment's psychotherapy or group therapy or medications or Lumit, the brain is able to regenerate and repair itself. But with Lumit therapy, we're actually telling the brain, okay, get busy here. Come on, let's get that BDNF going. Let's regenerate. And so patients get better much faster.
It's amazing. I'll be honest, like the brain is a very complex thing. And though I've been working with trauma, for a few years now, and just different people, them telling me stories, I'm not a therapist or anything. The brain is a hard thing to kind of wrap our minds around how that actually works. So it's very helpful to have someone like you explain it to us as to how that works. And I think that people, if they can understand what's actually happening in the brain, it makes it a little bit easier for them to, it's more hopeful in that it's treatable. In your book, does this go through and explain some of these different things?
Well, the book is in part talking about, predominantly talking about depression and PTSD and what that really means. Because we've been told for years that, oh, well, depression is, imbalance of chemicals in your brain. You don't have enough serotonin. We have to increase your serotonin by putting you on Prozac or Zoloft or Paxil. That's nonsense. That has been completely disproven over and over again now. So scientific studies have looked at the serotonin in the brain and depression. There's zero relationship. Okay, it's a happy accident that SSRIs increase serotonin and treat depression, but the two are not related. In fact, Prozac and Paxil and Zoloft, they very weakly, very poorly turn on BDNF and drive neuroplasticity, but they're not very good at it. Now, one drug that is fantastic at turning on BDNF is ketamine. And so in the book, I talk quite a bit about ketamine and ketamine infusion therapy and how that is a powerfully effective way of turning on neuroplasticity. Ketamine is become this kind of a rage in America, and you can't swing a dead cat without hitting a ketamine clinic in Denver, where I'm at, and I'm sure it's true in many other cities. And what they're doing with ketamine, actually, most of these clinics, is not the right way to do it, because they're saying, well, you got to get 6 infusions in 2 weeks, and so you get 6 infusions in 2 weeks, and 50% of the people don't feel better. And the reason is that neuroplasticity takes time. Neurons grow a millimeter a day. You're not going to fix someone in 2 weeks. So you had to give neuroplasticity time. And that time, is measured in 6-8 weeks. And so with our infrared light therapy, our patients are 6-8 weeks and their PTSD is better. Their depression is better. We have a 93% response rate. 93%.
Wow.
In the book, I also talk about I talk about one patient in particular, and I tell her story of, she came to us with a coupon. We'd put out a coupon. She comes in, she gets ketamine, gets better. But as she gets better, this is the trick of trauma. Our brain is smart enough to protect us from being overwhelmed. And so we won't remember trauma. We won't deal with it because it would be overwhelming if you're dealing with all this other stuff at the same time. So as she got better, her trauma memories started to surface. And then she, had to work through that, her child sexual abuse in therapy. And she did a combination of therapy, which is why she did body therapy and psychotherapy and group therapy. Because, as Vessel van der Kolk talks about, the body keeps the score, right? The body remembers. There's somatic storage of memory. So she did all of this work, and now, she's doing fantastic.
First, I have a question. Is ketamine a pharmaceutical drug?
Absolutely. So ketamine started life as an anesthetic, and it's in fact one of the safest anesthetics. It's the most common used anesthetic in children's hospitals because it's kids. You don't want to give them something that's going to suppress their respiratory drive or suppress their heart rate. And ketamine doesn't do that.
Mhm.
So ketamine has been used as an anesthetic for since the 1970s. And it was the discovery that low dose ketamine, not the kind of doses you use for surgery, but like 1/10 of that dose, and 1/100th of the dose that people abuse on the street. Those little low doses of ketamine had an antidepressant effect. And then it took us years to kind of figure out the molecular biology of that. And my book has has some of that molecular biology for someone who really wants to geek out, but it's all in the back of the book. So the main part of the book is you can read it on your couch, relaxed, with a glass of iced tea,
Mhm.
uh, or and then if you get really gutsy, you can go and geek out on the deep dives in the back of the book where all the science is.
The science, that's what is a lot, I feel like, to wrap your mind around. And
Mm-hmm.
I think in general, people are looking for, especially people that are like suffering through PTSD or suffering through different types of trauma, they're looking for a way to get out of that. And
Mm-hmm.
I think when you're in a desperate situation where your brain is saying this is hopeless or you can't think your way out of these things, um, you're kind of at a loss. I feel like a lot of people get to where they're at a loss. They're not sure what to do or who to call. Or, I had another guest on the podcast and she was talking about how she felt completely alone in her
Mm-hmm.
trauma because no one could understand what she was going through. And so I think that that's definitely something that people struggle with. And I think I love that your book covers kind of general readability in the first part of it, to just give people an outlet to say this is what's going on, and this is different ways that possibly I could treat these things that is going on inside of my brain. Do you treat people? You use ketamine sometimes, and then sometimes you don't. It just depends on the type of trauma that they've been through.
And sort of the pharmacological assessment of what's going on for them. Because ketamine infusion therapy isn't cheap. And if there's a medication that's going to work for them, or infrared light therapy is going to work for them, the LUMIT therapy, then ketamine may not be needed. One interesting aspect of this is that for the really, really tough cases, I put the two together. And here's why. Ketamine turns on BDNF. I remember I mentioned that. So it's turning on neuroplasticity. And LUMIT, infrared light therapy, turns on BDNF by different mechanism. So we get synergism. We get 1 + 1 = 3. And that,
That's
is amazing for really complicated, tough depression and tough PTSD.
mhm.
And the other thing that ketamine allows us to do is ketamine assisted psychotherapy. And in PTSD and trauma, can be very, very valuable. And there are lots of clinics now that are doing ketamine assisted psychotherapy. And when I do it, I usually bring in the patient's, real therapist. I don't try to substitute a, therapist of my own. It's like, let's bring in your therapist. And what happens is that ketamine is a dissociative anesthetic. So that means that at low doses, it's sort of like you take a step back from yourself.
Mm.
And the uh, the experience is that you can kind of see yourself in a little bit different light. So literally, in one of the most horrific trauma stories I've ever heard in my 25 years in psychiatry, we were working with her psychologist in ketamine assisted psychotherapy. And literally, she looks into his eyes and her eyes are wide. And she says, "You mean it wasn't my fault?"
Mm.
she got that insight because she could be, a step back from herself and not deep inside that shame and guilt that so many trauma survivors experience, so many abuse survivors experience.
So you work with all different types of trauma,
Mm-hmm.
different types of PTSD. Anyone could come to you with any type of issue, and
Yeah.
you could help them.
Mm-hmm. Yeah.
Yeah.
And certainly I have a tremendous amount of experience with sexual abuse trauma. I ran a nonprofit in St. Louis while I was a medical student. It was the Child Abuse Prevention Task Force. And literally what I did is I trained up medical students, and we went into the classrooms of elementary schools and talked to kids about good touch and bad touch and what to do. And we talked to teachers about child sexual abuse and talked to parents about child sexual abuse. And, we did this for 9 years. I ran that program.
That's
So
awesome. That's
it
awesome
was,
too, that for you doing that as being in college. What a
well, I was
action
in medical
taker.
school to be
Oh,
correct.
okay.
It was in medical school. But what I did is I taught medical students as well about this. All these
Mm-hmm.
students that volunteered to go out and teach kids, they learned about this. And you know
Mm-hmm.
what? Child sexual abuse gets about, you know, 2 minutes in most medical school curricula. It's largely ignored.
That's disappointing. But I can see, I definitely believe that that's the case, and it's really sad because the children are the future. And
Hmm.
so when you
Hmm.
corrupt them at such an early age, you're creating a plethora of problems going forward into
Yeah.
the next generation. So that's
Hmm.
um, that's crazy that it's not more focus put on that. But I do want to ask you a little bit too about, we've talked about the ketamine, but I
Hmm.
want you to talk a little bit more about this luminance therapy, the
Yeah.
infrared light. Is this something that is this a certain type of infrared light? Because I
Hmm.
worked at a med spa for a while. We did like the infrared sauna. Is that the
Hmm.
same type of light, or is that different?
Great question. Yeah, and I get that question a lot. So infrared light is a pretty big spectrum of light. It goes all the way from visible light to microwaves. And so there's a whole lot of different wavelengths in there. The infrared saunas are at the long end of infrared light, closer to microwaves. And so really what you're getting is heat. And heat is good in a variety of ways. It penetrates the muscles and relaxes them, and it's helpful in chronic illnesses such as chronic fatigue syndrome and chronic Lyme disease. Um, but the wavelengths that we're working with are able to penetrate tissue. And the trick is that in the mitochondria, there's what's called the electron transport chain. I won't geek out too much, I promise. But there are little enzymes that are what create enzymes. So there's this whole chain of enzymes. Some of the enzymes contain copper. And so just like our hemoglobin contains iron, and that's what allows the hemoglobin to pick up oxygen one place and drop it off another,
Mm-hmm.
the copper allows for the movement of the electrons. Now, certain wavelengths of infrared light are absorbed by that copper and turned into an electron, turned into energy, and turned into signals. So it's really about, there's only certain wavelengths that activate those enzymes, very specific. Now, what we did was, we saw the research that was going on at places like Harvard, where there are, let's take 50 mice, whack them all in the head the same exact way, and then 25 will treat with infrared light and 25 who won't. And lo and behold, the ones who got treated with infrared light, their brains healed. And they had very little neurological deficit. They could walk and do all these things that, the brain injured ones who didn't get treated couldn't.
Mm-hmm.
And so all that research was going on, and they're looking at mice. And let me tell you, the skull and scalp of a mouse is a lot thinner than, say, a
Mm-hmm.
human's. Our skulls are pretty thick. Mine is thicker than most. And, you had to have enough power to get through the scalp and skull to get to the brain. So what we did is we grew up that technology so that we went into the lab and we, took tissue, human tissue and sheep brains and sheep heads and da 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 da, and figured out how much energy you had to deliver to the scalp and skull to reach the brain and directly
Mm,
turn on those mitochondria in the human brain.
right.
And so we published that in 2015, and we've been treating patients since then. We started with brain injury. And then we noticed, gosh, all of our patients who had depression along with their brain injury, their depression was getting better. So we studied depression and then, PTSD. And then, COVID hit. And we had all these, 30% of people who get COVID get some form of long COVID. And we started treating those patients, and lo and behold, that their brain fog and their fatigue and all that would go away.
Mm,
So it's been remarkable, and we're learning, literally every day with every patient, I'm learning something new. And again, we, see a fair amount of PTSD. I want to put a plug out there for veterans. Our original group of patients that we treated, about half of them were veterans. One was a bomb diffuser. He had 8 IED explosions that he was exposed to. And the benefit for them was tremendous. And so we formed a foundation, the Neuro-Laser Foundation, which is a nonprofit that subsidizes the treatment of veterans and first responders. And speaking of first responders, I want to put a plug out for the film Residual. It's just come out, and it's about PTSD and trauma in first responders,
mm,
and it features one of our patients and his remarkable recovery, as well as other types of treatment. So, you know, the first responders and veterans, if they're out there and they want treatment for trauma, reach out to us and we'll be able to subsidize part of that treatment.
wow, that's awesome. So, do you still work in large part with veterans?
It's actually a small part of what we do. It's a lot of a lot of the patients that with PTSD that come to us, quite frankly, are coming from the attorneys in divorce cases. And divorce is horrible, and I always think I've heard okay, now I've heard the worst divorce story ever, and then next week I get another one that's even worse. And so whether it's the husband or the wife in the divorce, it can be horrible.
Are you seeing like abuse situations in divorce or emotional abuse, as well
Hmm.
as physical abuse?
Absolutely, absolutely. And so some of these patients are so paralyzed they can't even fill out the paperwork. I mean, looking at the paperwork, they just give up and crawl into bed for a day and hide. And then, we treat them. And, one of our patients who was like that, she's now advocating for herself in court. She's like, hold it a second. You can't do that. I mean, I mean, she's now organizing appeals, and it's so tremendous to see, that she's got her strength back and she's got her power back.
Sometimes in the middle of a divorce, for example, there's financial things as well as advice from attorneys that says shouldn't spend money. What do you have advice that you give someone, like maybe they can't afford the treatment, or they have to be very careful in how they spend? Do you have advice or like a starting thing that you take them through before they actually can invest in treatment?
Well, yeah, every patient gets evaluated by me to determine, what's going to be best for them. And sometimes that's lumit therapy and the infrared light therapy. And sometimes it's ketamine, and sometimes it's pharmacology, and sometimes it's, I get them in with some of my amazing psychologist colleagues here in Denver. So
Yeah.
it's very individualized.
So you kind of consult with people, tell them what they need, and then give them the best point of action based on what they need.
Mm-hmm. Mm-hmm.
And sometimes that could even come from possibly starting out with just the book, reading the book at first. I ask that only because I know that sometimes when people are in the middle of going through a traumatic situation, if finances is an issue, then also now this is another stressful or a source of hopelessness. If you're listening and you feel hopeless, don't, because there's resources.
Yeah.
I
In fact, let me add one piece to this, and
Yeah.
it varies from attorney to attorney, but sometimes, the attorneys will foot that bill, and that will get, because they need their client healthy in order to be able to get the best outcome. And they want their client to be healthy so that they can take care of their kids. This is all really important stuff. So in the sense of, I've yet to have any attorney say to me, oh, no, 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 we don't want to make them healthy, you know, for the divorce. No, the complete opposite. And I like talking with the attorneys, because then we're on the same team, right? We're on the same page, and we're not fighting each other unintentionally.
That's awesome to know. Because that's something I feel like, especially if you're going through divorce, it's like, how many times does one go through a divorce in their life? Um, Hopefully not many. So,
Let's
you
keep it to one, okay?
right, or none. But if you have to go through it,
Hmm.
you are faced with these things, and it's always good to know your knowledge is power. So it's good to know what you can and can't do. And I think that the my heart behind everything that I do, even here on the podcast, is just to help people not feel hopeless. Like, there is a way to move out of things, and I'm a firm believer that all people need therapy at some point in their life on some level. Because I don't remember if we spoke about this once we got on the call or before we started recording. Everybody has some form of trauma, which this is something I wanted to ask you as well, because there is this misconception that misperception. Did I say that right? Anyway, there's this thought process that says, if I'm not a veteran, if I'm not a first responder, I don't really have PTSD. And this has come up in other conversations, but I would love your thoughts on that, or how you respond to that if a client were to come to you and say, it's not really PTSD, it's
Mm.
something else, because I was not a
Hmm.
veteran.
Well, I mean, I'd say that's poppycock. Everyone can experience PTSD. I'll give you my example, and this isn't in the book. In the book, I talk a little bit about my childhood experience, which was, yeah. Moving on, but when I was in medical school, my long-term girlfriend, probably would have been my fiance, was sexually assaulted, and almost killed. She ended up in the ICU because the guy throttled her to the point that she had stopped breathing.
Mm.
Um, and I was there at her side the entire time, and I was there through her recovery and through her therapy work, and and I figured out who had done it. We didn't, at the time, it was just some guy who had busted in her door. I figured out it was the guy downstairs in her apartment, and eventually, pushed the police to investigate, and they arrested him, and we went to trial. And his public defender got him off because he claimed, well, um, she's Chinese. She can't recognize a white guy. So how could she possibly point and say that's the guy that did it? Because they can't recognize white people. And the jury bought it, and he was cleared. And she and I both just went into a deep, 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 dark place. I remember trying to walk from my car to the university, and I felt like I was walking through cement, wet cement. I could barely lift my feet up. And my brain wasn't working. And it was like, get through the day, drink myself silly. And she's right there by my side. And hold each other tight and cry. And that went on for months. So here, I was in no physical danger, but for me, the trauma of the system letting us down was so horrific. And then, we got better and we're going about our lives, and we moved to St. Louis together for me to go back to medical school. And we get a call one day, and it's the district attorney saying, yeah, this guy did it again, but this time he's convicted. Would you like to give a statement to the judge about, for sentencing purposes? And it's like, and we went through it all over again. We went through a episode of PTSD that lasted weeks because of that. And finally, us writing, me helping her write that letter, that was the thing that kind of helped us to feel better. Ultimately, was to take some of that power back that was taken away from us, that was taken away from her. And for me, essentially it was all vicarious, right? Nothing happened to me directly, but I still went through PTSD. I still went through horrible trauma. I still felt like, hopeless and that life was over. This would never get better. So I get it. I know I've kind of walked in those shoes for people who've gone through trauma. I've been there. That's the adult trauma. We won't even talk about the childhood stuff.
Yeah. Well, and this kind of brings up a point as well. There is this thing, and I learned this. So I got into first really kind of dealing with trauma because I was doing photography, and clients would open up to me and share some of these different types of trauma they had been through. And I started doing these photo shoots around it or whatever. But one of the initial things when I first started doing this was that I know re-engaging trauma can be traumatic in and of itself. And I would love you to clarify this, but my understanding is when we go through some type of traumatic situation, we a lot of times want to kind of suppress. You want to push it down, suppress it, not face it, not heal from it, but you just push it. And eventually that never works, because eventually what's going to happen is you're going to be triggered, you're going to explode. But then you face the alternate version of that, which is I face this, I heal from it, but now I'm running in straight proximity to pain and hurt because I'm having to re-engage this trauma. So I can relate to how people possibly would feel like I would rather just suppress and not talk about it and pretend like it didn't happen. Is that your perception of how that works? And based on your experience, because you went through this, is this something that that you felt like was happening once this kind of was drug back up?
Yeah, it's a great question. And I think The Body Keeps the Score is a wonderful, wonderful book. And it's really true. It's like we store memories in our joints and our muscles, and that way we don't have to think about it. But it does come out eventually. So in what's going on with the brain in PTSD is that circuits are breaking down and the frontal cortex is working less and less and less well. And so in part, that facilitates sort of hiding from the trauma, hiding from the memories. So with treatment, as the brain starts to recover and starts to form new circuits and repair itself, then that stuff becomes available. So in a way, what I'm saying is sort of what I said earlier, which is that the brain protects us until we're ready to deal with a particular piece of trauma. And trauma work doesn't have to be going back and reliving every freaking moment of it, right? You don't have to do that to do therapy. That's the amazing thing about Lumit, is Lumit, I'll give you one example. A veteran, his trauma was 50 years ago. He watched his buddies die. And, he was wounded himself. and had terrible trauma. Every time the jets fly over, we're near the Air Force Base, so the jets fly over, he'd be in the basement crying. He came and got it for red light therapy, and he was amazingly fast. 6 treatments. On the 6th treatment, it was like it didn't bother him anymore. He was done. He was done.
Mm-hmm.
Jets, no biggie. And so it doesn't have to be just going through every single experience. And this is in part what EMDR is about. EMDR is not about, okay, do this and tell me all the traumatic stuff. It really isn't, because and particularly if you combine EMDR with metaphor work. That is, you don't have to go through the details. You can do this all in metaphor. You can do this all one step removed. I used to do a lot more EMDR than I do now. But I was here in Denver when Columbine happened. And so a few years later, there's all these kids with all this trauma. And so I would work with these kids, and I worked with rape victims, and I worked with people with other types of trauma, childhood abuse, etc. But we did it all sort of one step removed. So it was, the beautiful story of one of my Columbine survivors. I mean, it was all about giant mushrooms and playing basketball and a jar full of sunshine. I mean, it was all, one step removed from we're in the school and people are shooting and my boyfriend got killed. It was removed from that. And so I think there are different ways to approach trauma. So ketamine, for example, again, you're one step removed. And so you can look at it in a different way. The progress that's being made with MDMA assisted therapy is the same sort of thing. It's giving you that little bit of cushion between you and the trauma. You don't have to wallow. You don't have to be sucked into it again. You don't have to wallow in it. You don't have to be wounded by it again. And I think that's so important, is there are different ways to work on PTSD and this body work as well. If you work with your body, you're not like reliving, that day when you were 6, you're not reliving those kinds of things, but you're still doing the therapy that helps your body release the memories and the trauma, and your brain to recover.
Trauma therapy has come a really long way. I'm thinking, of course, I've not really been as engaged in this field like my entire life, but from what I'm seeing, it seems like mental health, people are giving mental health a priority, and the therapy for trauma and for PTSD seems like is improving, maybe as we learn more and speak more. And there's not as much of a shame surrounded, because I know sometimes with certain types of trauma, there's shame surrounding that people don't want to share their story, or they don't want to talk about what has happened. Do you think that we're making strides in the treatment of PTSD and trauma?
I really do. I really do. And I'll give you one example. When I was in high school, I finally, said, okay, I need to talk to someone about all this stuff that happened, because I'm like, and I talk about this in the book, that I basically bargained with myself to stay alive, to not commit suicide when I was in high school. And, so I go to this therapist, and, 6, 7, 8 sessions in, I'm talking about all this stuff I experienced and how I feel and how hopeless I feel and how useless I feel, and how dirty I feel and how ashamed I feel. And, he says to me, you're right. Your life is hopeless. You're screwed. This is what he said to me. Now, maybe he was trying to reverse psychology me and make me mad at him, which is actually what happened. I came back and told him, screw you. I still, felt suicidal until until I was about 30. When I turned 30, I never thought I'd turn 30. I never thought I'd live that long. And so the day I turned 30, I said, wow, I guess I had to get serious about living. I guess I had to get serious about this because I'm still here. And that's really when it changed, for me. That's when fundamentally, I changed directions. Now, specifically on trauma therapy, how has it changed? Well, I think the awareness of, the amazing work of Bessel van der Kolk on understanding trauma and how our bodies store it and how our brains store it. The amazing progress in neurobiology of understanding that it's a degenerative process. The amazing work of EMDR, and understanding more about how EMDR allows us to pull back from the emergency response, the fight or flight response that trauma triggers in us. So all of that amazing work, I think, has really shifted the way therapists approach trauma. And so if you're not getting that, if you're in therapy with someone and they're not kind of helping you to create that distance so that you can work on it, one step removed, then it's kind of time to look for a different therapist. I'll say it frankly.
Do you have advice as far as if someone was looking for a therapist in their area, what things they would look for, or what things it's kind of like the baseline or guidelines for that?
I mentioned EMDR, and I think you can go to the EMDRIA, EMDRIA, which is the association, and look at a directory, and they'll show you how well educated someone is in EMDR. And so you want someone who's at the level, a higher level in EMDR than, say, just having first done it. And people who have experience working with trauma will use different, modalities. They'll bring different things in. Ketamine-assisted psychotherapy is growing rapidly. Although there's a worldwide shortage of ketamine right now, go figure. I mean, and epinephrine and half a dozen other medications. And this work on MDMA has been amazing. The clinical trials got messed up because, what happened? One therapist decided, okay, I think I'll molest my patients while I'm giving them MDMA. Really? So that's delayed the clinical trial. It's disgusting. It's abhorrent. But that's delayed the clinical trials that lead to FDA approval. But there are centers that are doing MDMA therapy. And always, I think there's some really important books to read. Sure, my book, but The Courage to Heal. A classic in child sexual abuse, and to this day it remains a very, very valuable book. The Courage to Heal workbook that goes along with it. I can't tell you how many patients we walked through that workbook together. Again, a plug for Bessel van der Kolk's The Body Keeps the Score. Amazing book that's really, really helpful to understand what you're experiencing. Because if nobody tells you that you're getting massage and all of a sudden you're bawling your eyes out because somebody got under your shoulder blade, I mean, it doesn't make any sense, but it happens all the time.
I want to ask you this. If
Yeah.
someone is listening, per se, and they're on the fence of, like, they're right there as far as suicidal, what advice would you give them, like, right now?
So one of the things that I think goes on in our minds is that we believe that this is how it's going to be forever. And if this is how it's going to be, I gave the example of the trauma that my girlfriend and I went through. If this is how we're going to feel for the rest of our lives, this is pointless. Check out. And so it's really, really important. And your brain gets stuck there. And that's part of the changes that go on with PTSD is your ability to have foresight, your ability to see the future, that can be different, to plan, to organize, to organize yourself and not to escape from an abusive relationship. So literally just right before I got on with you, I was talking to one of my patients who she's in the middle of a nasty divorce, but it took 2 years to get her to the point where she could leave the house. It took 2 years. And, it was every day helping her to kind of grow a little stronger. So what do I say to someone who's right there on the verge of suicide is that things can change and things can get better. And this is not the rest of your life. This is a moment in time. And suicide's a permanent solution to a temporary problem. So, because I've lived it, I know. I've made that decision every day not to commit suicide, not to hit the steering wheel and go right into that concrete wall that I drove past every day on the way to work or way to school. I made that decision. So I know, you know, you have to kind of have, it's not faith in a way, but you have to have the realization that things can change, that things can get better. And then, that's the first step to having the strength and taking back a little bit of the power in order to be able to change that situation. So let me touch on something with you that you brought up. You brought up shame and guilt.
Mm-hmm.
And I talk about this in the book when I'm talking about this one patient's journey. And it's really fundamentally true. One of the things that human beings hate the most, that we're most afraid of, is being out of control, right?
Mm-hmm.
That's why we like roller coaster rides, is that feeling of being out of control. It's that, it's going to end, right? But for a moment, you can feel that fear. But it's terrifying. It's terrifying to be out of control. And people who are in abusive situations, people who are being raped, they're out of control. They do not have control of the situation. They are powerless and they are controlless. And so one of the things that our brain does to protect us from that fear is to say, well, I had a little bit of control here. Yeah, my stepdad said, well, you're so cute, I just can't help myself. Well, okay, it was my fault. I was too good looking. I was too cute. Or, well, if you hadn't worn that dress, somebody says, that wouldn't have happened to you. Well, your clothes have nothing to do with whether you get raped or not. But you grab onto that, say, oh, there's my little bit of control. And that becomes your little bit of guilt. And that becomes your whole lot of shame. And so, we always look at shame as sort of a bad thing, but it's actually protecting us. It's protecting us from that feeling of being out of control. And so, I help patients to sort of start to realize, there's that connection back to guilt. And what's the guilt for? Oh, well, I did that. Well, how did that cause you to be raped, or how did that cause you to be assaulted or abused as a child? How did that cause you to watch your buddies get killed next to you in a war situation? And so there's that connection between our desperate need not to feel out of control and guilt and shame.
That's very insightful. I've never thought of it like that. I think of guilt as something happening and maybe we don't react, and then later look back on it like I should have responded or reacted differently. And I think of shame as if like this is something that obviously we take the blame that these things happen at some point, because otherwise why would we not, why would we be shameful in sharing those things?
Mm-hmm.
So that's very insightful that that you shared that. So I know we're kind of getting to the end here, but I do want to ask you this. Well, first, I want to say, like, if somebody was looking to try to find you, what is the best way? And we'll put out everything in the show notes as well, but like, it always helps to say it here too. What would you recommend them do to get in contact with you?
Yeah, so our website is neuroluminance.com. So Neuro hyphen luminance, LUMINANCE.com. And there's a place to kind of ask for a consultation, and we provide free 15-minute telephone consultations that I conduct, so that we can find out if what's going on, and are we the right people to help, or is there someone else? I mean, I'll refer patients who are out in California to a clinic in California. But sometimes it's, really, the only place to get Lumit, the only place to get laser unattenuated multi-watt therapy, the infrared light that gets to your brain actually, is here in Denver. There are companies that are selling LEDs that you can stick on your head that have infrared light, or shove one up your nose. But these LEDs are half watts. They're half watt of power. A half watt of power doesn't even get through your skin. I mean, it's a great way to grow hair. You want to grow hair, get that little cap and put it on, and you'll grow your hair back. But it's not going to reach your brain.
That just brings up another question for me. Is there an age limit that you work with, or, do you work with kids? Do you work with elderly? Do you work with anybody?
Yeah, I limit my practice to 3 to 83.
Okay. Just a little limitation there.
There you go. I actually I'm fellowship trained in child psychiatry. So I'm both an adult psychiatrist and a child psychiatrist. And so with kids, we do a lot, we're not rushing to get kids under a laser, for example. But, we are treating kids 12 years old, 11 years old, who have ADHD. And this is an amazing kind of complete aside. The infrared light therapy actually really helps ADHD. So we have kids now who, they don't need to take a stimulant anymore. And we have adults who don't need to take stimulants anymore. So we're just scratching the surface what Lumit can do, which is part of what the patents are. And then I also do work with chronic fatigue syndrome, which is fascinating, and another place I geek out on. So, again, I can help 3 to 83.
That's awesome. So any closing thoughts or remarks that you have, or anything you'd like to leave the guests with that have listened this far?
Yeah. So, I'm a bit of a Renaissance man in the sense that I have my hands in a lot of different pots. I like that keeps me stimulated. And the laser unattenuated multi-watt infrared light therapy, or Lumit, really is revolutionary. This is the fifth branch of medicine, and it's going to really change how we approach depression and how we approach PTSD, and of course, other things like traumatic brain injury, and other brain disorders. And I could geek out on that for hours. But my hope is that people will start to consider Lumit therapy when they're struggling with PTSD, going through that nasty divorce and feeling overwhelmed and stuck. We really see tremendous benefit for patients. It's very safe, it's very comfortable, and it's right here in Denver.
So definitely learn more about that. I am a firm believer that try to treat as holistically as possible without having to get into the pharmaceuticals, because we obviously do have side effects with those. So I think that what you're doing is awesome, and that your research and everything, your patents, and I'm excited to see what the future of treatment looks like for PTSD and trauma, and some survivors of abuse and all these different traumatic things. So appreciate your work, and I appreciate you coming to share with us today. Definitely go check out Dr. Henderson. He's doing amazing things, and look into some of his work if you're struggling at all with trauma, with PTSD, and you don't really know where to go from there. I'd love for you to reach out to me. I'll try to point you to the right resources. I know Dr. Henderson has a heart for what he does and would love to help you and point you in the right direction as well. So thank you so much, Dr. Henderson. I appreciate it.
Thank you so much for having me. It's been a real pleasure, Amber.
Thank you. Pleasure's all mine.
Thank you for listening to Through the Trauma podcast. If you have found value in this episode or believe in the mission behind what we are doing, please subscribe so that you never miss any future episodes. Also, be sure to check out our transformation project at transformationthroughtraumaproject.com, where we help inspirational stories get heard on a larger scale through multiple platforms. If you know someone who can benefit from this episode, please share it with them. Until next time.